Aloha, Hawaii. It's time for the Vein Clinics of Hawaii radio show. Their team's approach to diagnosing problems and developing solutions and treatment plans are beyond compare. So let's get started with your host of the show, Mike Buck, and medical director, Dr. Randall Juliff of the Vein Clinics of Hawaii.
And once again, aloha and welcome to our program. I'm Mike Buck here at the Answer, and the answer today is all wrapped up around Vein Clinics of Hawaii. It's a show that really points out some of the things that can be done to deal with cosmetic issues, certainly of spider veins, and then varicose veins, and a whole lot of things in between. There are 4 Vein Clinics of Hawaii clinics in the state, on the Big Island, on Kauai, on Maui, and here on Oahu. Dr. Randall Juliff is the proprietor, and so he's the head guy. And we're going to really educate you. And if you were with us on our last show, we mentioned a little bit about this thing called spider veins. And, you know, are they cosmetic? Are they health-threatening? Are they life-threatening? Why do people have them looked at? How is the modality changed? How is it a little bit easier to do in the back days? And I'm going to start right off, Doc, by telling you that when we had a discussion off the air, I would have thought that spider veins are the engine that drives about anybody into a vein doctor's office. But I'm 95% wrong because he said, no, it's about 5%. That's amazing.
Yeah. Well, it's about 5% of people that come in strictly for spider vein treatment, the purely cosmetic. Yeah. Now, when we see a lot of people come in and their primary complaint is spider veins, but many people aren't aware of the other side of the medical side of vein problems in general, and we have to investigate that. And that's sort of the first question that has to be answered. Is this just a part of a bigger problem, or is it just spider veins? Okay,
these are some of the questions that I bring to the table, and you're going to be able to do this by going to veinclinicsofhawaii.com and click on the info button and submit questions to be heard on our program. And one of the things that I got to know, first of all, is I know because I've had spider veins removed from my legs. Do they happen in places on the body other than the legs?
Oh, yeah.
Okay.
Yeah, they can happen all over the place.
Really? Yeah.
Yeah. We treat, legs. A lot of people have spider veins in the face. We do inject facial spider veins.
See, I thought that those were from beer or something, but they're spider veins.
In some cases, they are.
The good beer, anyway. Yeah. What I mean to say is that I suspected that it was pretty much in the legs because that's where it seems like some of the other venous problems are really in the legs. That's what you specialize in, right, as a surgeon. But I think that if it's self-esteem or if it's just beauty or if it's somebody that says, I don't like to go to the beach anymore, I don't like the way my legs work, let's talk about that. Let's talk about that person, man or woman, but in many cases, gals that I know, that a lot of you gals, and it's about self-confidence and all these things. What does the treatment of spider veins entail? What do you do for these things?
We got a number of different things that we can do. There's no question about that. But let me make a comment about what the point you just made, and that is that it's always surprising to me how much spider veins and those type of issues with people's legs really do affect their self-esteem and how they handle themselves day to day. I can't tell you the number of people that come in to our office who have vein problems of one sort or another, and most of them are unsightly, and say, "Oh, I haven't worn shorts in years."
I got the case in point. One lady, as a matter of fact, says she actually quit playing tennis.
Yes,
because she was embarrassed about the backs of her thighs and her calves and varicose veins, and once she got them treated, back out to the court.
Yeah, well, that's good.
That's the big thing, isn't it? Yeah, it is.
Oh, yeah, and it's tremendously satisfying for us, in the office, to treat these people and then hear those stories afterward, where a lot of ladies will come in and say, "Oh yeah, I'm back into my short skirts," and it's great because their whole quality of life has improved from something as easy as getting rid of spider veins.
Okay, now a lot of times people remember when Grandma had her veins stripped, and this was like really big time. She was in the hospital. am I guessing correctly that spider veins, and particularly the modern treatment, you walk in, you walk out.
Yeah.
I mean, it's not a big invasive surgery because you don't take them out, do you?
No, we just inject. But in what Grandma had, when her legs were all wrapped up, I mean, Grandma probably didn't even have the opportunity to have her spider veins treated. But she had, other things going on that were, treated in a lot different way than what we do things now. But yeah, it's as simple as, coming in and we inject them.
When you say that you inject them, and I learned this in our last show, I always want someone to say, "Ooh, I hate injections." The ones that I've had lately, either the needles were really, really small and really, really sharp because they don't hurt like they used to do.
Yeah, they don't. The needle that we use is tiny.
Yeah,
it's the tiniest needle we can get. And we change it frequently because that helps with, you said sharpness. Those little needles can break down quite.
Well, what about the stuff that you actually inject? What is that?
Well, there's a number of different things. In the years gone by, a lot of people were injected with a saline solution. It was hypertonic saline. It was a little stronger, kind of salt solution. And that did a pretty good job. It created a little bit of stinging, a little more discomfort than what we do today with the medications that we have. But nowadays we have a couple of different medications. One is called Sotradecol. That's just the name of it. Another one is called Polidocanol. And
see, these are the things, folks, that the doctor has to know. It's all like the medicine you see advertised on TV at night. Do not try to pronounce it. You can't pronounce the stuff. It's very difficult.
Yeah, you have to.
So is it because certain veins respond better to different stuff?
I think as our experience gets greater, and as new things are developed, we're able to find better modalities than what we had in the past, just like anything else.
Sure.
The things that and depending on the size of the vein, people come in, and if we're again talking about just the strictly the cosmetic kind of patient, spider veins entail a pretty good group of different types of veins. They can look. Their patterns can be different. Their locations can be different. They're all kind of
how about like length and size of them?
Yeah, well, and that's what I was getting at. There's one particular medication that we might use when we're talking about the tiniest of spider veins. Very, very small, very superficial. We might use a different medication if it's on a little bigger, bluer, a little deeper kind of vein. So it depends on the type of vein, the type of pattern, and we try to use the best medication that we can.
Does it involve bleeding when you treat these veins?
It does not. It does not, because is there a tiny amount of blood in spider veins? Yeah, usually there is, but I mean, we inject it, and when we inject, the blood is removed, and it just
okay. Now, when you look at this spider vein that's red,
yes,
is that blood? Is that red blood?
Yeah. Mm-hmm.
Is it move? Does it move?
Well, when we inject it, you can see the move.
Oh yeah, I'd get right out of there if you injected me too. But what I'm saying is that vein stationary where it is, that spider vein? Does the stuff going through it all the time?
Well, no, there's blood in it. It's not like it's not like it's tremendously functional.
In other words, it's not necessary for your circulation.
No, not in any way.
Yeah, thank goodness.
Is there when we inject it? What I was going to say is you can see the medication go through the vein. And the blood being removed, being pushed away.
Is that fun through. when you're actually doing this, to watch the work as it happens?
Yeah, kind of.
Yeah, I would imagine it is.
Yeah. And people, when there are other people in the room, everybody gets intrigued when they.
I can imagine.
The medication
look at that.
goes in.
What intrigues me, and I'm sure you've handled any number of different patients on this, is maybe what brings them in, but maybe how long they've had them.
Yes.
Yeah. Decades.
Yeah, years. Yeah. And things, vein problems in general, they don't happen overnight.
Yeah.
Just like the varicose veins and other larger issues. But spider veins the same way. And we hear that all the time where, ladies come in or men and they say, gee, I've had this spider vein since I was in high school or a teenager. And they can laugh. They can be there for a long time.
I every now and again find myself looking at the outside of my left knee where I had this thing that was about as big as a silver dollar. And it was there probably 30, maybe 40 years. And he said, well, I can treat that. We'll do it. Boom, gone. But I think that must be the fun part of what you all do.
Oh, yeah.
Especially if somebody is, first of all, what you said before is 99.99% of this, if not all of it, this cosmetic spider vein stuff is done with what, local?
Not even local.
Yeah, not even local. Yeah.
The again, the needle is so tiny that it would hurt more putting the local anesthesia than doing the
note to myself, tell the dentist that I tried the high-speed drill before the stuff that he gives me. This might hurt a little bit. But don't a lot of people have a preconceived idea when they come that you can see they're pretty nervous?
Oh, yeah.
Yeah, because they're worried about, is this going to hurt?
Oh, pain, needles especially, and
needles,
discomfort. I mean, it causes a tremendous amount of anxiety, yes.
I can tell you, and some of you that are familiar with our regular shows during the week, when we do the Tourism Tuesday, there are more and more opportunities for people that need to get this work done, maybe, because it almost is part and parcel of what they are. We're talking beach attendants, poolside people, waitresses, waiters, everybody. We're in here, take a look at us. We're healthy people thing. This is what we're selling. I would imagine that there's sometimes an uptick in that. But one of the things that always comes up, and I need you to address the difference between an elective procedure like getting spider veins treated. At which point in time are spider veins treated not as cosmetic, or are they all cosmetic?
Well, the spider vein treatment itself is always cosmetic. Mm-hmm. Because which means your insurance company is not in line to pay for that. Right. Yeah. Because there is no major functional problem that arises just because you have spider veins. The question always is when somebody does come in to the office with spider veins, is this just strictly spider veins, or is this just another sign? That's why we're doing this show today, folks, because we need to know the transition that goes on, and the doc that's treating you for the spider veins is also able to take a look at some other things while you're there, and this is important stuff. Yeah. And that's the most important question. Are the spider veins maybe a part of or another sign for bigger vein problems that need to be evaluated? And we see that a lot. People often will come in and their primary complaint is, well, gee, I have all these spider veins, and then we talk to them more. And we ask them, questions about symptoms that may be related to poor vein function of the veins that are deeper in the leg, and often those answers are positive, and so then we need to evaluate them further. And luckily, the evaluation is pretty simple. Yeah, and here's another thing. And I know that although a lot of us out there listening, and me and Dr. Julep, we are all in the 4-word business of how much is it. Everybody wants to know how much something is. But I can tell you, and Doc can put it into the medical terms, that the way this is done now with the sharp needles and the solution that you use, I'm imagining that a patient can endure much more treatment per visit, which was going to actually help control the cost of that cosmetic surgery by not having to go for 5 treatments or 6 treatments on one leg. Sure. Yeah. How do you determine what a person can take or how much you can do? Is it based on how much time the patient has to spend or the doctor has to spend? Yeah. Well, that's how we do it. We go by sort of time units. But we spend nearly an hour with people when they want spider veins treated, and I have found that in general, we can address most of the major issues of their spider veins, both legs, front and back, over the course of that period of time.
Yeah, which is really what. And by the way, that is really flying in terms of how it used to be. And I do know that, and I want to liken it. Some of you all know that I grew up in the retail business. My mother stood on her feet in her stores for 40 years, and she was a model. And one of the things that she had was every now and again into the doctor back in the old days of Straub and going in and getting the veins done. And this was something that a lot of people on the beach did. And it wasn't necessarily for vanity, but it was for self-esteem, which I guess is the same thing in some respects.
Yeah, that's part of it. But yeah, those people, it's kind of the same population of people. The people that are probably the most concerned about the appearance of their legs are those people who are often in the public and are, their legs are exposed. And they're on their feet all day long, which makes them a little more at risk for developing, vein issues like spider.
Okay, now that was the other question, because in other shows we talk about the legs and the lower extremities are where a lot of these venous conditions come in that are way more serious than the spider veins we're talking about. But I'm guessing that maybe somebody that stands, if you had two people, identical twins, and one of them stood for a living and one didn't, I would imagine that the one that didn't would have less spider veins.
Yes.
Yeah.
Well, and vein problems in general.
In general, because. Now, what about that though? We've talked, and we will talk on many other shows about who gets it and who draws the lucky genetics card out of the family deck when they get these things. Is it indicative that the spider veins can also be in the same way,
genetically predetermined? Yeah, sure. We hear that all the time also. Where somebody will come in and we talk about the genetic component, and they say, "Well, I have two sisters and they have perfect legs. Why did it have to?
What happened to me? Yeah. You got dad's genetics. Mom had the other. But I still think going back to this is what brings people in. The side benefit, obviously, is that you now become aware of this whole thing called the circulatory system. Maybe you're going in for something simple, and you end up saying, well, listen, while I'm here, what about a tune-up? And I was pleasantly surprised to find out from Dr. Juliff earlier that that's the case. Here's what I need you to do. Let's say that you're hearing the program and you say, hey, I want to try that. I want to go there. I want to go to veinclinicsofhawaii.com and take a look around. When you go to the website, you'll see some really interesting other procedures that are done. And I'm supposing what's happened is you've increased the number of services you provide based on the number of patients that want to do other things once they said, hey, this was nowhere near as bad as I thought it was going to be. I want to look even better. What else can I do?
Sure. Yeah, we hear that all the time.
Yeah. What else can I do? It's too late for me, friends. I mean, I'm looking as I'm it. But I'm particularly talking about people that are in the field a lot, and people that are in sales, and people that are in personality jobs where they have to look pretty good. Otherwise, somebody's going to concentrate on a blemish instead of hearing the pitch. Mm-hmm, mm-hmm. Do you get that sometimes? And let's talk about guys and spider veins for a minute. Guys do them.
Sure.
As often?
Oh yeah. Not as often, but they do. Mm-hmm. And there's plenty of men out there that have spider veins. Yeah. They're a little more reluctant to admit that the appearance bothers them. But it does. It has to.
I got to tell you, especially as you get older. I remember my first grandchild said, "Hey, Papa, what's that? Does that hurt?"
Yeah,
I don't want to say "get away, kid." But,
right.
But that I get it. I get it. Where people would started to feel a little self-conscious.
Sure. And the place that most people hate the most is the little spider veins that they get down around the ankle. Mm-hmm. Many people have that, and that seems to be the most irritating to people.
In the big picture, I know we've already talked about how easy it is to deal with them, to dissolve them, or to get that fluid in there and make it go nice. But I'm also guessing that sometimes when somebody notices that, it's because, did I do this to myself? Did I cause this? Is it you said in a previous program, and maybe you had to reiterate, you can't say, well, eat more carrots and you won't get spider veins.
Yeah,
that's not that easy.
Unfortunately, no. A lot of people, what we talked about before was a lot of people come in with, a story of some traumatic kind of injury, minor usually, got hit by a baseball or a soccer ball, fell down the steps or whatever, and they're convinced that, the spider vein spider veins that they have on their leg was due to that trauma. Well, it may or may not have been.
Well, we need to rationalize, Doc. We need to think,
Oh, yeah.
I don't know how I did that. I guess it's baseball.
Yeah.
We don't want to say it's just maybe genetics. One thing that, and Dr. Juliff and I talked off the air about this, it is a unbelievable thing that's going on in the world about tattoos. And so it led the question that I wanted to find out. Let's say that somebody has this really nice eagle tattoo on their leg. And when they get it, it's fine. Can you get a spider vein in a tattoo?
Yeah.
Yep. And
you can, but depending on what the tattoo looks like, you may not be able to see it. The tattoos actually hide the spider veins sometimes.
Mm-hmm.
As a matter of fact,
that's my next question.
Yeah,
how many people get tattoos to cover venous problems?
Yes, not a pretty good number.
Yeah. Wow.
Yeah, I've heard that story, over and over.
I can't see it. It must be okay, right?
I guess.
Well, it's gone. I can't see it anymore.
Right, right. Yeah, it is one way to get rid of it. That's for sure.
But I'm thinking, and we talked about earlier when you do the treatment for these spider veins with these incredibly sharp needles. I thought, well, you keep changing the needles, and I guess that's because as a practitioner, as it gets where the needle's not working as well as it did 2 veins ago.
Yeah, the needle that we use is so tiny. Mm-hmm. That it's actually affected by going through the skin multiple times, and it can dull the point.
That's
of
amazing.
Yeah, so we change it out so that it's more comfortable.
Okay, now and we want to make sure that you understand that the spider veins, you're not put under. Doc says you don't even use a local. I know that they used to use locals because I think it was a bit more problematic than it used to be. It wouldn't stand to reason that a big needle would work in a small vein, would it?
No, it wouldn't. And there's some other problems with that too, because you can put a little bit too much pressure. If you put too much pressure on the vein, through the needle and the syringe, it can cause trouble with eliminating that spider vein. So the other reason that we use such a tiny needle is to limit the pressure, but also be able to get into these tiny, tiny veins. Many of them are the size of this tiny needle that we use.
That's what I was going to say. And then the other thing is, from what people always ask, is it instantaneous? Yeah. And is there a lag? I know that a lot of times that you might have to tell a patient, just be patient. They're going to go away. Yeah. And how come they do that? Are you traumatizing that thing when you inject that stuff in there? Is that what makes it work?
Yeah, there's it's not a perfect system. Mm-hmm. Like anything else. Yeah. Spider vein treatment is not a perfect system. And one of the first things that we see is that when we do the injections into the spider veins, like I mentioned before, we inject a clear fluid into it, and it's tremendously impressive to everybody watching. The spider vein complex just kind of disappears.
I'm fascinated by that. I saw a video on that. It's fascinating.
But, and there's always a but, that usually that it doesn't remain completely disappeared. And when you see somebody when you see a video, usually on YouTube or whatever, of a spider vein being injected, that's the part they show you.
Yeah, I was going to say, hey, look, there are certain really good things about the internet. There's certain things that are not so good. Yeah. And I know that a lot of you physicians, surgeons like yourself and others, it's sometimes really, really bad to go look at a YouTube or go look at a Google and think that's what I've got, and then sort of, how can I manage it myself? Not a good idea.
Yeah. But, what happens is that the solution that we're injecting into the spider vein, the way that it works is that it causes inflammation.
Gotcha.
Inside the spider vein. And the tiny, tiny little veins. Yeah. And what it causes is irritation and a breakdown of the inner lining of these tiny
That's what I was getting at. That's what's happening. You're breaking it down.
That's the chemical part of what's happening. And you're not really breaking it down. What happens is that inflammation then causes these tiny little veins to collapse, and the opposing walls stick together, so blood can no longer go through them. That's how they disappear.
Gotcha. So wait. So the blood that's in this thing that's collapsed, that's still there, are we talking about it taking a day or two to dissipate and get away from there?
Well, the blood's gone right away.
Oh, okay.
Yeah.
Oh,
but what happens thereafter takes a while.
Oh, okay. Yeah.
Getting back to your point about being patient, you have to be patient.
Yeah, I tell you why I think that's important, because it's a leap of faith. I mean, I know that, what have you done for me lately? I mean, if somebody in the medical profession causes somebody undue pain, they're not going to go back there again.
Oh, no.
But what you have is in 4 clinics, the ability to treat people on a regular basis with the certainty that, look, this is tried and true.
Yeah.
Here's what we're going to do to treat you, and here's what to expect. And take a picture and text me when it's all gone, because it is going to go away. I love that part of it.
Yeah. Well, yes and no.
Yeah.
Yes and no. I mean, the reality of it is that it's not like we inject a bunch of spider veins and then they just leave you forever and ever, never to come back. Unfortunately, it's not like that. But what happens immediately is this inflammatory response.
Gotcha.
And that's how these little veins collapse. Now, what's going on the surface of your skin as this inflammatory response is happening? It looks a little red. It looks inflamed, and you might have a little bit of bruising. So we tell everybody, after we treat the spider veins, there's several days where things actually look worse.
Oh, yeah.
And so they actually look worse for a little while before.
Like a bruise, right? You get a little bruise, and then
like
it got this big yellow, brown stuff later. Oh, my goodness.
Yeah.
It's getting worse.
Yes.
Yeah, it's healing.
Yeah. So it takes 4 to 6 days for that initial inflammatory response, the redness and the inflammation, a little bit of swelling, a little bit of bruising. It takes 4 to 6 days for that to go away. Now, after 6 days, after that goes away, then the spider veins start to look better.
Gotcha. That's really gotcha. Yeah.
But even that process then is slow. I tell everybody that actually we see improvement in how the spider veins or how the spider veins look for about 3 months from one treatment. Now, that's good because we see improvement for 3 months, but it doesn't happen overnight. It happens over a 3-month period that there's a gradual improvement in how those spider veins look.
I think that's an important point to carry out, and here's why. I do know that many, many, many of your patients, like I was, when I got my spider veins treated, had them for decades. And it's hard to believe for the patient how quickly in real time they go away. And now that they're not free of it, because what you did was erase maybe decades of me thinking my legs were ugly. Now they look okay. But whatever caused that to happen, we didn't fix the cause, we fixed the effect.
Yeah.
So they can come back. I mean,
sure.
You can get new ones.
Yeah, sure. And also, they don't all go away during one treatment session. This is another thing that I tell people, that from one treatment session, if we get about a 50 or 60% reduction.
That's the number I'm looking for. Yeah, that's good.
In how visible those spider veins are, that's an average, average amount of decrease in the spider veins.
So that is a fairly predictable result, is that you're pretty much going to get rid of half of the problem in that visit.
From one visit.
From one visit, right.
So there's the other thing.
How high do you want to fly?
Exactly.
What's next, right? Yeah.
So the question is, or I tell everybody that it may take more than once, and this also goes to being patient. Now, how many times is it going to take? Everybody asks that. How many treatments am I going to need to get rid of these spider veins? And it depends on 2 things. How well each individual responds, because the response is variable from one person to another.
I'm guessing, too, Dr. Juleff, that you can take a look at patients all day long, and every one of them are a little bit different.
Oh, yeah.
So for some people, they can expect it's going to take longer. Some people walk in, walk out, they're in top shape.
Yeah. So it's very difficult to predict, too. Sometimes we can make a judgment based on their skin tone and their skin type, et cetera, how much pigment they have in their skin. But it's hard to predict how people are going to respond. So I tell them, I don't know. It all depends on how you personally respond. And it all depends on what your particular happy point is.
There you go.
Where are you going to be relatively happy with the amount of spider veins that we've gotten rid of? For some people, that might be 1 treatment.
Sure.
For some people, it might be 3 or 4.
So, I'm thinking it was like me. I had a lot of them done later because it wasn't for vanity, just because I had the opportunity to get them done. But there was that one that did bother me.
Sure.
And it went away.
Yeah.
So that, to me, that was the home run. That was all I expected.
You had a home run there. Yes. You had a very good response in that one location. And that's great.
Yeah.
Now, which brings us to another point: expectation.
Mm-hmm.
You have to have realistic expectations about everything,
Yeah.
but especially when it comes to spider veins. You wanted that one spot bothered you tremendously.
I did. It really
responded
did.
well,
Yeah.
and boom, it was gone. You're happy.
Yeah. But here's the thing, gang. If you go to veinclinicsofhawaii.com, you're going to learn about the 4 locations on Kauai, on Maui, on the Big Island here in Honolulu. You're going to learn about what Dr. Juleff and his staff do, and you're going to also learn how to sort of evaluate, okay, wow, this is like a new discovery. And what's happened is there's a lot of things that go on there that are cosmetic, but there's also a real big niche for people that have real problems, and that's what we're going to talk about in other shows. But going on to some of the other stuff, I noticed, for instance, with spider veins, that you have all of these other things, body contouring and all that. I think once you develop a comfort level with the place that you are and the professionalism of the people, you're willing to say, you know what, this has always been something I wanted to look at. So, I mean, that must be tremendously gratifying for you and your staff. Some things must be kind of tough, but some things you must, when the last patient leaves for the day, it must be, holy smokes, we had a great day.
Oh, yeah. Well, and it's all about, making people happy, making people a little more comfortable in their own skin, and in treating medical problems, But with respect to the cosmetic issue, we love it when we hear people say, oh, yeah.
Sclerotherapy, what's that?
Sclerotherapy is, injecting spider veins is one form of sclerotherapy. And that word comes from sclerosant. We use a sclerosant to inject into a vein. That's the thing. That's why it creates inflammation inside that vein. That's why it causes the vein to collapse, is that inflammation inside the vein.
And, one thing that I expect is going to happen, that many of you are going to be intrigued to go look at the website and then go down, make an appointment to go down and talk to them and find out what sort of a plan. The real victory to me, and I know this because in what we do, we know when we've done something right, and when somebody gets a big benefit of something. When somebody, let's say, is like Dr. Juleff and I were talking about a while ago, a lady stops playing tennis with her pals because she's embarrassed about her veins on her legs. Some of these are spider veins, and some of these are not. So some of these, let's talk about what other things are visible besides a spider vein on somebody's legs. Besides an ulcer, for instance, and the discoloration of the skin, which we have talked about, and a spider vein. The other veins have an appearance that bother people.
Sure.
Yeah.
Well, there's a number of different types of veins.
Yeah.
Spider veins is one of them that may be associated with an underlying problem. Of course, varicose veins.
Yeah.
And most people know what a varicose vein is. It's a ropey little, vein that is on the surface. You can feel it. Often it looks like a little ball of grapes, often near the knee. There are other veins. There are veins that we refer to as reticular veins, which are blue and big, and also can be associated with this process of venous insufficiency.
But by the way, Doc, aren't they the ones that people like pump up when they're doing like the bodybuilder thing? Look at these veins, man. I'm strong and healthy because my veins are popping out.
Yeah. Some people like them.
Maybe not. Yeah, some
people
like them. Yeah, I like those. But what I'm guessing at is that people go through a period of inquisitiveness and then discovery. Mm-hmm. But hey, I came in here to get this thing on my leg worked out. But I've since found out that maybe I should just be aware of what's going on with the rest of me with regards to maybe other procedures that I want to do. Once I've got that doctor-patient relationship with somebody, I feel better about saying, all right, what about this? What's it going to take to take the next step?
Well, I think identifying things that they feel need to be corrected or that can be corrected. We in the Oahu office here recently, we've added some further cosmetic kind of things aside from just vein work, and has to do with skin resurfacing of the face and getting rid of pigmentation,
these
sun
stings, right?
damage, and that kind of stuff. So
that's another thing, and I know a lot of people ask you, well, did I get these spider veins because I'm at the beach all the time? Is it something from the sun? I think that all of us are waking up to the fact that being out in the sun and getting leather skin for many, many years is a real big problem. That's why I would imagine practitioners like yourself and others are pretty pleased to see some of these chemicals being removed from some of these lotions, because it might let people stay out less of time or cover themselves up a little bit more.
Yeah, with each year that goes by, we're learning more and more about the sun damage, which I wish I would have known when I was young.
Oh yeah,
because
me too.
I don't know about you, but I used to, we used to put baby oil with iodine.
Oh, listen, let me tell you, here in Hawaii, it was the Monoi oil from Tahiti, and some people even put a couple of drops of soy sauce in it to make them. So we were cooking ourselves.
Sure.
Now, when we were doing that, have we caused any problems to our veins? Is sometimes just that exposure outside of that heat and that sun, and that toughness to our skin, can it hurt us?
I don't think there's any direct relationship between sun damage and
that's good.
Skin and vein issues. No,
but the reason why we wanted to spend as much time, folks, today on spider veins is whatever it takes to get you to the next level of awareness, because I think that, when we were talking earlier, Dr. Juliff, you were talking about some people have symptoms that they don't even know are symptoms of a venous issue. Their legs are tired. They work all day and they get home and they can't wait to put their legs up. Doesn't that mean that there's something going on in there, not just muscularly, but maybe other things going on inside that leg?
Oh, yeah. Definitely. And we hear this all the time. People come in and say, "Well, I thought I was just getting old."
Yeah.
Well, you can age and not necessarily have symptoms.
Yeah.
Achiness, heaviness, fatigue, swelling. Your legs get tired quicker than they used to. That's a very good question that we ask everybody. Do you feel like you need to elevate your legs at the end of the day when you go home?
Yeah. And are you surprised at how many people say, I got to?
Oh, yeah.
I do that every night.
Yeah. Well, and that's a surefire symptom right there, because as you elevate your legs, you're eliminating
guess what?
The poor function of the vein. Sure.
Here's another question. And I know a friend that has this, and hopefully he'll come in and get some treatment, because he has a lot of issues with one leg and not the other. As a matter of fact, he was talking about valves, and he found out, years ago that one of his legs doesn't have very good valves in it at all. So this guy, it's the same body, but it's two totally different things. Is that common?
It's not common, but we see it periodically. What I think you're describing is probably somebody, unless they had another issue, but somebody that was born without valves.
Yeah, it could be.
Or
I don't
without
know the
functional
answer to that.
valves.
Yeah.
Now, but that all, when somebody comes in with symptoms and findings in one leg and not the other, that always raises a bunch of red flags, like, what's going on here?
Yeah, this guy worked in the ranching business.
Yeah.
And he was on a horse a lot.
Yeah.
And he'd get home at night at the end of the day, and one leg was killing him every night.
Yeah, yeah. It's hard to know exactly what was going on.
But, I mean, this guy went to x-rays, he went to treatment, they couldn't find anything wrong causing him pain like a fracture or stress or a break or a tear. It turned out that he had very, very poor circulation in that leg.
In just that one leg. Yeah. Usually that's a congenital problem, likely in one way or another. But there are other, mechanical reasons why someone may have swelling and symptoms, discomfort, pain, etc., in one leg and not the other, that has to be probably investigated beyond what we typically do for routine kind of things.
What kind of detective do you have to be to differentiate between what one patient says is an achy feeling, the other says it's a burning feeling, the other one says it's a heavy feeling?
Yeah.
Don't we have some pretty creative ways to decide what we feel like?
Oh, yeah.
Yeah.
We words mean different things to different people.
Does,
And, you just kind of have to work through it.
Okay, so our talk, let's go back so that you remember in this program what we were striking out to do, and that was to talk about spider veins. And a lot of people, I thought it was an inordinately large number of people, but Dr. Juliff says no. I mean, about 5% of new patients come in just for spider veins. But I'm guessing that a lot of people that come in with other conditions since they're there, hey, listen, while we're here doing this on me, how about can we get rid of some of this stuff that I've had for my life?
Oh yeah. The flip side of the coin of the patient who comes in just for spider veins.
Yeah.
Are everybody else that we treat for medical reasons, and then in addition they also have spider veins, and they want them treated. So we typically in those patients we want to treat their underlying venous insufficiency first.
Gotcha.
Because the spider veins are often a result of the underlying venous insufficiency.
That's what I was trying to ask you. We want to make sure that it's clear that it doesn't mean if you have spider veins that you've got big varicose vein issues. But it's possible.
It is.
In other words, what you're saying is I want people to understand that. If the spider veins bother you and you think, are they symptomatic? I mean, I do know that they are cosmetic, but do they ever hurt?
Some people do report that they are they can be achy.
Yeah.
And even in those patients where we have done the studies, where we've done an ultrasound, where we find that they don't have significant venous insufficiency, some people will still insist that they hurt. And I can you can only believe them.
Yeah, I'm thinking, and that's why I asked differentiate between one guy says tingly, one guy says numb, one guy says burning, one guy says achy, but it's the same leg.
Yeah, sure.
Just perceived differently.
Right, right. And unfortunately, though, with spider veins, by the insurance companies, spider veins are still considered cosmetic no matter what. Whether they're achy, burny, itchy, whatever.
I guess maybe someday a case can be made. I do know that we're trying to get more proactive in preventative medicine, right?
Yeah.
I mean, by getting people before they're in a gurney, for instance.
Yeah.
But, I think that people need to know that a lot of us are probably under some sort of venous condition that needs treatment, but it's happened so slow that we just never find out about it. Therefore, if you are looking at it from strictly as a cosmetic thing, hey, listen, while you're there, pick up a few of these brochures and say, is this me?
Mm-hmm. Sure. Yeah.
Not a reverse Google on watching a sclerotherapy on YouTube, where they only show you the real pristine one, right?
Right, exactly.
Yeah. Okay, now I want to make sure that people understand that, though, because that is not the way that the vein clinics of Hawaii are making it. It's not a money factory for doing cosmetic vein stuff, but you understand the reality of how many people will originally think there must be something wrong with me because look at these legs. I don't like them. I got to get them changed.
Yeah, sure. Yeah. I saw a lady today who called and came in and wanted strictly just to know about spider vein injection.
Mm-hmm.
Well, over the course of then her, coming through the front door, talking to, the ladies in the front, and then the nurse that brought her back, and then finally with me, she, over the course of those conversations, she came to the realization that, I guess I do have some varicose veins in the back that I wasn't really. That's
exactly why I wanted to differentiate between this, because I do know that a lot of what you do is writing up for people's health insurance and everything else. What is an issue that needs to be corrected? It needs to be aggressively treated, and that would be a varicose vein that is on the surface, maybe surrounded by spider veins, but not a spider vein.
Right. Yeah. And then the more I talked to her and asked her questions about potential symptoms, she was saying yes to everything, and especially to the question of, when I get home at the end of the day, my legs feel tired and terrible, and I need to elevate them for an hour and a half, and then they start to feel better.
One of the things that we have issue with, and I know that we all know this, the age of retirement is moving up. The availability for Social Security matching the lifestyle you need to lead is, so a lot of us need to readdress ourselves and say, what's it going to take to make me stop aching at night, because I actually have to take another job. Mm-hmm. So I need to get in better shape, and it's not cosmetics at all. It's I need to do this because I want to see what I can do to help my body be able to withstand more work.
Yeah. And if it's the spider veins that bring them into the office,
hallelujah.
That's fine with us.
Yeah.
But I just wanted to make a few more comments about the the reality, the expectation of what people can think about happening with spider vein injections, and again, kind of having a realistic goal of where you will ultimately get. And I want to stress the fact that you really have to be patient. And if you are, those people who are patient and can be persistent in their treatment, we will ultimately get most of those people to the point where they're pretty happy.
I was going to say, you know what? Maybe that's where the name patient came from.
Yeah.
If you're going to be a patient, you must develop some patience.
Yeah.
I wonder how that started in the first place. You know, we talk about whether it's a client or a wounded warrior or anything, it's a patient.
Right,
yeah.
right. Yeah.
Maybe, and I do know that time is of the essence. And one of the things that you have to know about Dr. Juleff, that we actually record these shows so that you're hearing him when you are, because he's a busy guy. He's skating around all the islands, Kauai, Maui, the Big Island, here on Oahu. That must mean that, time is money. And so when you do that, you're going to make sure that you effectively be able to treat somebody in the limited time that, anybody ever has, is to get the most done for the buck. In other words, really be able to be aggressive and do a lot of stuff all at once.
Yeah. We the way we have things set up is that wherever we are, doing procedures.
Yeah, pretty intense.
That's what we do. Whatever office it is that week that we're there doing procedures, it's pretty chaotic.
Yeah. I do know one thing, by the way, time management, and we've been talking about this off the air too with Dr. Juleff, is the key. So what's happening is staff and the procedures that you've developed are pretty pragmatically structured. You have we're going to see 14 people today, folks. So here's what we're going to do.
Yeah. Everybody has a job. Everybody knows what it is. And things luckily work, like clockwork, and we get a lot done in a day. Sure.
One of the things, if you didn't learn earlier, Doc's been highly credentialed and highly educated, and actually got into this. And I asked the other day when we were talking about why this particular field of surgery, and I guess it's because it's pretty fascinating when you take a look at this circulatory system we had. It's probably one of the most complicated things in our bodies.
Yeah, well, I was, as I was going through surgical training, the vascular system,
sure.
the cardiovascular system was really what I was attracted to. But in particular, so for many years I did open heart surgery and vascular surgery, like bypasses down the leg and cleaning arteries out, fixing aneurysms, all those sorts of things. But I can tell you over the last 8 or 10 years that I've really concentrated on vein disease, it has been fascinating because I think there hasn't been any other facet of surgery that I've been exposed to recently over the past 10 years that has changed so much in the past 15, 20 years that there have been in the process of treating people with venous insufficiency.
Yeah, I think that's incredibly interesting. Here's what I tell you. We talked earlier, and we're going to talk some more in future programs. Spend just a minute here in talking about when somebody has ultrasound done, because from what I can imagine, that the development and the continuing development of that particularly technology in your field has really made it much better, much easier to treat somebody because you can identify things a lot better.
Oh, absolutely. I mean, the evolution of the ultrasound machine and its improvement over the years has allowed us to do the things that we're doing now in the office under local anesthesia. Before we had ultrasound, we had to do, complicated, what's called venography. Yeah. Shooting dye into veins and watching it with the fluoroscope, travel up the leg and all that.
By the way, this didn't this used to be, because I remember talking to my grandmother about this many years ago. It was actually pretty painful. Because they put it in on your foot, and they're going to watch it go up your body.
Yeah,
Jeez.
Yeah. It was not comfortable.
Yeah.
It was not comfortable.
So in other words, that procedure itself, doesn't that create a lot of opportunities, technician opportunities, because this tool is being more and more widely used?
Oh yeah, definitely. Yeah, there's a educational. Facet of medical devices that
when you do that, let's say that you have a patient that really ought to come in more often, but let's say they come in every couple of years to get a little thing here and a little thing there. Are you able to see massive changes? Do you keep a record of the the ultrasound that I had somehow so that you can compare it with me 3 years from now?
Yeah, absolutely.
Yeah, how does that happen?
Well, I think one of the problems with the way that vein care happened before, when I'm saying 15, 20 years ago, was that people came in, they had their vein stripping or whatever they had, and then they were sent on their way.
Yeah.
Because nobody was all that interested in the therapeutic procedures that we had back then. They were just not very appealing either to the patient or the doctor. So I think that the main draw or the main problem with the way patients were treated back then is lack of follow-up. And because again, since venous disease is a genetically predisposed problem, we're not changing the genome. The genes are staying the same, and they are going to leave the door after we've treated them fully. They're going to still leave our office with genetics that predispose them.
But what I think is interesting about that, and you can correct me if I'm wrong, but let's say that I've had a procedure, and the pain and discomfort to do with that particular procedure I had kind of goes away because I had the work done. But it I guess if it's going to come back, it creeps back in again. Yeah. When 2 years later, you might say, "Doggone it, I hurt again. I got to go back to the doctor."
Yeah. Well, we try to remind people to come back in. Yeah. And our follow up is that we do a couple of ultrasounds over the course of the first year of the patient completing their procedures. Thereafter, we try to get people to come back every year or so for an ultrasound. We call them surveillance ultrasounds, just to make sure that they're remaining status quo. They don't have anything new coming up. If they do, we catch it early.
That's the point I'm trying to make.
Yeah.
And so I get it.
And that's the way the whole process should be handled. If we handle it like that, then major recurrences should be minimal. We shouldn't have people coming back with a bunch of new varicose veins and new problems with lower vein function. Interestingly
enough, and I'm guessing that the ultrasound will give you the practitioner saying, you know what, we don't really need to do something with that, but I want to see that again. That's not going to stay static. It's going to change a little bit.
Absolutely.
And the likelihood of them getting better is less than they are the likelihood of getting worse, right? I mean, when they say "physician, heal thyself," that must be pretty hard to do for a patient to do that to themselves.
Yeah. Right.
Okay, so just so that we make sure that you know what the deal is on the wrap up here, this show, the Spider Vein show, it gives you a lot of hope at the end of the tunnel for self-esteem, for sure. But it also gives you a more awareness of what you might find at Vein Clinics of Hawaii. And I think that maybe that the real reward is not somebody being all happy with, just that my leg doesn't look funny anymore. But you know what? That other leg, it doesn't hurt anymore now that I've had that procedure. That must be what drives you and all your folks.
Oh, yeah. Making people look better is a nice thing too. People are very happy about that. But the vast majority of the patients that we see, we want to make them feel better.
And part of that can be, and we've said this before, just the self-esteem. And I want to harken back to the lady that we talked about earlier, the fictitious lady that didn't want to play tennis anymore. I bet you that every now and again you'll see somebody at a store, somebody will come in for a little tune-up and say, you know what? Boy, am I glad I did this because I'm getting pretty good again. I can play tennis or I can play golf. I'm getting pretty good.
Yeah.
Okay, so if you want to get pretty good, if you want to feel pretty good, here's what you need to do. You need to go and check out this website, VeinClinicsOfHawaii.com. And one of the things you're going to learn, not just about the 4 clinics, but about some of the staff and some of the other people, which we'll get into in other shows. But I think that's the big challenge, Doc, is to maybe explain what time management is, and maybe people got to get in the loop. In other words, to start feeling better, you got to start doing something about it.
Oh yeah.
Yeah, you can't.
You got to act on it.
Got to be action. So that is our call to action. So go to VeinClinicsOfHawaii.com and see what's going on. We'll see you next time. Thank you very much for listening. Tell your friends about us. We'll be back again next week, same place, same time. Aloha until then.
Well, that's our program for today, and we certainly hope you enjoyed meeting us. Please come back next week for our next episode. And in the meanwhile, to learn more, please visit our interactive website, VeinClinicsOfHawaii.com. That's VeinClinicsOfHawaii.com.